Hi, good afternoon, everyone. Happy fall. It's great to have so many of you joining us today. For those of you who may be new to these webinars and don't know me, I'm Emily Beauregard. I'm the director of Kentucky Voices for Health and a member of the Thrive Kentucky campaign. As always, we've got a lot of great new updates for you. Well, I can't say that they're all great. Some of them might not be great news, but we have a lot of good information for you on state and federal policies and everything that you need to know about the status of Kentucky's safety net programs. I know that most of you are familiar with Thrive Kentucky by now, but Alex, why don't we advance the slide? If you're not, if you're new to these webinars or Thrive Kentucky, I want to share, some of the guiding principles that we use to inform our work, to guide our work. Our mission is to meet the basic needs of every Kentuckian through systemic change, because we recognize that many of our fellow Kentuckians face historical and systemic barriers to meeting their basic needs. So these guiding principles help us to determine what kind of policy advocacy work we do, where we focus our attention and our time and energy. And you'll be getting slides electronically as a follow-up to this, as well as the recording. So don't feel like you have to read everything on the screen as we go. Here are the members of our Thrive Kentucky campaign, and many of these organizations are going to be part of the presentation today. If you're interested in learning more about any particular organization, you can click on these hyperlinks. Let's go to the next slide. Always want to say thank you to our sponsors who support this work and make it possible for us to offer these webinars free, offer CEUs for certified community health workers and for social workers. And we also have a roadshow that we're doing in person once a month in different parts of the state. Our sponsors help to support the cost of doing that as well. And so if you haven't already joined us for one of these roadshows, you have a couple more opportunities. We'll be in Lexington this month, and then we'll be in Paducah next month. I can't believe it's almost the end of the year. And then we'll be doing a virtual roadshow in December for anyone who just couldn't join us in person on a date that worked for them. So please join us for that. It's all of the same kind of safety net programs that we talk about during these webinars, but we talk a little bit more about the purpose of the program, who's being served, who's being left out, and we do a lot of advocacy training in addition to what you get during the webinar. So it's a good one not to miss. And if anybody is interested in sponsoring, please always reach out to us. Here's the agenda for today. This is what we're going to be covering this afternoon. And during each section, rather than waiting until the end for your questions or comments, just put them in the chat as we go. We find that works best. And if we can't get to everything in the 90 minutes that we have, we'll do follow-up, responses in an email. And just some quick housekeeping. We have a lot of folks on the webinar today, so please do stay muted and use the chat if you have a comment or a question. I mentioned already that we're recording this webinar. We'll share that recording with you, as well as the slides, the PowerPoint deck, and any other materials or resources that we talk about today. That'll all come to you in a follow-up, along with an evaluation and information about CEUs, if that's something that you want to receive for attending today. Kelly is our go-to for CEUs, so she'll put her contact information in the chat. So you can reach out to her if you have any questions or need anything there. So with that, thanks again for joining us, and I'm going to pass it to Kelly to get us started.
Hello, I am going to attempt to fill some very big shoes. Dr. Schuster typically offers you this part of the program, but my name is Kelly Talby. I'm the Director of Communications Development for Kentucky Voices for Health, and a little different than usual, we're going to start with a kind of a federal update. We had a much different idea of how this was going to go last week, but on Saturday, September the 30th, this past weekend, a pretty significant crisis was averted. Our federal delegation all chose to delay a federal shutdown until November the 17th. There were some compromises made. They removed and stripped funding and relief support for Ukraine, for example. But it was a bipartisan agreement at the end of the day that has prevented a lot of harm from happening. Had that government shut down on Sunday, October the 1st, there would have been an immediate impact to the WIC program. Uh, and Dustin shared last week, 1 in 3 infants in Kentucky get their formula nutrition using WIC support. That would have been devastating for so many of the folks that we know and serve and the individuals you help on a daily basis. SNAP, they would not have seen their routine annual adjustments that went into effect recently that I bet Cassidy will say something about here in a little bit. There would have been some security for about a month, and then those monies would have lapsed as well. And while Medicaid and Medicare funding would have been protected to an extent, logistical technical support, rank and file, through federal employee furloughs would have caused a lot of issues. And during a time nationally where we're Medicaid renewing, that would have been a very bad scenario. And while we're talking about the programs, we're also not talking about additional real people impacts. Kentucky's home to about 36,000 federal employees and an additional 35,000 active duty military personnel. They would have stopped being paid. And so both for the individuals accessing the safety net, other hardworking Kentuckians, it just is something that we shouldn't even entertain as a policy option. Compromise is always available. We have a call to action still available here for you. It's important our federal delegation continues to hear from us. 45 days is not very long. And depending on how conversations the next few weeks go, on the November 14th webinar, this might be a little more urgent of a message that we have to share with you, depending on what it's looking like. But hopefully they will not dangle another federal shutdown moving forward. There's not really a segue here, but we're going to go to the next slide. So back on the state level, we talk to you often about the various task forces before the state legislature. The Certificate of Need, the School and Campus Safety Task Force, and the Kentucky Health and Human Services Delivery Task Force are both 3 that we're closely monitoring. They continue to meet. The CON task force had a public input deadline of September the 1st. While we've not heard public conversation about a lot of those public submissions, we anticipate that to happen at an upcoming meeting. The School and Campus Safety Task Force, again, focuses a lot of its attention on mental health. Dr. Schuster, in fact, testified a week and a half ago. At their most recent meeting, they kept her for well over an hour, like usual. Most people are awarded, maybe 15 minutes. She is a veteran that they really tap into and is often there for an hour or more. The Health and Human Services Delivery Task Force most recently met last week, hearing from some social workers that you all may know personally on the ground, and seeing some of the both barriers, obstacles, but then also the good systemic outreach that we do have and support each other with. Those are important meetings to pay attention to. These task forces will develop reports that often become bills. And those are some upcoming meeting dates and times and a link to access and watch, or if you want to watch the archive versions. Next slide. Dental, vision, and hearing regulations. You all have heard from us quite a bit this year about these, and it's important to just keep in mind that no matter what, at least until the end of this calendar year, these services are available. We are advocating for permanency. I think Tiff Hayes is in the room. She has recently joined us at the August hearing and testified. Many individuals, both on the community professional side, consumers impacted by the delivery and access of these services, it's important to stay engaged. And this is an area where our footprint, your words and experiences are valuable. So stay tuned. We will hopefully have a better update for you next month on what this is looking like. Next slide. This is just a quick recap, a repeat slide Dr. Schuster has for you about some of the changes going on. Senator Elkins, we have mentioned before, he has been sworn in, and he does serve on quite a few committees that we all pay attention to. Health, the Families and Children's, the Health Services, State and Local Government, He is one to get to know if you've not met him yet. While we had a short session, which is kind of a salty word for it's long anyway session, this upcoming year is a budget year. It will be a lengthier, more turbulent legislative session. And Dustin will probably talk to you about the economy and what things are looking like on that front next. Next slide. Just another balance of power breakdown for the state legislature. We do have a vacancy while Senator Elkins was just sworn into a vacancy during the primary election. During the regular election here in about a month, Representative Swan, who recently passed away, leaving his seat vacant, that seat will be filled, and there will be a new House member sworn in to fill out the remainder of his term. Next slide. All these things I'm talking about for the state level is about the 2023 interim. It is important to know that unless they're called into a special session, they can't pass bills, but regulations are going through the process and they are developing their policy priorities for legislation. And again, all the special committees, the task forces, you can go on to the next slide too, Alex. These will be developing, if they've not already submitted reports, they will be submitting reports in the next couple of months. Those again will often take shape into bills. So those final recommendations and findings are areas where we always want to pay attention. Next slide. This is a repeat slide, but we feel it's very important. Get to know your folks. Just because your program or your office or you yourself have been working in your community for 15, 20, 25, however many years, doesn't mean that maybe your legislator hasn't only been serving for 2 or 3. So reach out to them, get to know them, tell them what's important to you. And again, this is a budget session coming, so they need to know if you have budget priorities personally. Next slide. 2023 is also an election year. So while we are anticipating legislative machinations in January, it's also important to remember there is an election in about a month. There's a huge voter registration deadline next week, October the 10th. So this is the time. Every friend, family member, individual you're working with or for, just ask them if they're registered to vote. And if not, please direct them to govote.ky.gov. This URL recently changed. So if you have been using govoteky.com until now, please know that that website does not automatically redirect you. It should be sending you to govote.ky.gov. It doesn't. That's just a technical, unfortunate thing that's happening right now. But get folks around you registered to vote. It's very important. It is a statewide election year. Governor and other constitutional officers are on the ballot. Next slide. And I will hand the virtual mic off to Dustin, who will talk about economic updates.
All right. Hey, y'all. Happy Tuesday. We like to kick off sort of the policy section of our presentation with a little bit of overview of what's going on with the economy and how we pay for all of these programs and supports that we're going to refer to. Because the extent to which folks need help with their groceries, with their housing, with their healthcare, really depends on how we're doing as a whole economically. So let's move on to the next slide and start by talking about what's been going on with our jobs. So, you know, obviously, one of the best ways to gain economic stability and security is through employment. And Kentucky has been going through really one of the most historic recoveries, and honestly recovery that we've experienced in our state's history. So folks will remember that 3 years ago, 3.5 years ago now, we shut down much of the economy to try and avoid spreading COVID-19. And between that and a shift in purchasing services to purchasing goods, there was a big drop in employment. But we realized the mistakes of the past, particularly in the Great Recession, and we invested billions of dollars in our state economy through the federal government, through things like boosted unemployment benefits, things like protections in Medicaid, direct funding to state and local governments, stimulus checks, the child tax credit. And what we've seen is one of the most rapid recoveries on record after losing nearly 3 times as many jobs as we lost during the Great Recession. So we lost just shy of 300,000 jobs in April of 2020. Since then, we've gained back almost 362,000 jobs. So we're now actually 3.4% above where we were in 2020, and we have more people employed than we've had at any other point in our state's history. So let's move to the next slide. And even though the recovery has been really good, one sort of outstanding question we've had, especially as we were recovered from the Great Recession, is how are we doing compared to where we would have been had nothing happened? And even if you compare our current level of employment to that, we're actually doing better. So we've caught up to where our labor force would be had nothing happened. And again, to put that in perspective, we had never caught up to where we had been pre-Great Recession. So it really has been a significant return to something close to normal. We now have almost 45,000 more jobs than the population adjusted labor force had nothing occurred. And while we do have a smaller labor force participation rate, that's largely because of older folks finally getting to retire in larger numbers, and a lot of folks staying at home caring for sick loved ones or elderly loved ones or their own children. We're moving in the right direction. We do have others that are not in the labor force than were there before. Places like the St. Louis Federal Reserve has done some really good research to show that we have fewer immigrants in our labor force, and that the excess deaths from COVID actually had an impact on our total labor force. So, we do have folks who are not in it who might have been in it otherwise. But generally speaking, we've been heading in the right direction. So let's move on to the next slide. One other way of sort of indicating the health of our labor force is how many folks are getting laid off. And maybe the best metric for that would be the number of unemployment insurance claims that are being taken out right now. That blue line you see there that sort of spikes and then drops off is the number of continued claims. So these are folks who asked for unemployment benefits, were accepted, and needed more than one check. And that's a good indicator of how many folks are getting laid off. That number obviously dropped below that yellow dotted line, which is kind of where we were prior to the pandemic, and has stayed below there really since September of 2021. So for over 2 years now, we've had a really, really low number of claims. And just by comparison, initial claims, which are folks asking for help for the first time, are right around half of where they were prior to the pandemic. So really a lot of folks on the job and staying on the job, which is really good news. So let's move to the next slide. So even if you have a job, that doesn't necessarily mean that it's easy to afford the things you need to live off of. So obviously, I'm sure everyone on this call has noticed as their grocery bill has gone higher, as they've had to pay more for rent, as other goods and services have gotten more expensive. That really peaked last year, and we have gotten closer to what you might consider a normal rate of 2% inflation. We're not quite there yet. So if you look at all items, inflation for all items, we're around 3.7%. If you look at what's called core inflation, which is everything except for food and energy, we're down to about 4.3%. And if you look at food has really dropped dramatically. It peaked at almost 11.5% year over year growth in prices back in August of last year. We're down to around 4.3%. So still higher than it needs to be, but somewhat manageable. There's another measure of inflation that came out last week that just looks at personal consumption expenditures. And it showed actually that the core for that measure of inflation dropped below 2%. So again, things are moving in the right direction. They're moving there quickly, but we're still not quite where we need to be to sort of have a manageable growth in prices over time. So let's move to the next slide. Now, one thing that would really help, especially lower wage folks, be able to afford the things they need to get by on is if they got a raise. And unfortunately, we have not raised our minimum wage for over 14 years now, which is the longest stretch we've ever gone as a country or a state without increasing our minimum wage. It's still stuck at $7.25 an hour. If you adjust for inflation, that's right around where it was in the year 1950, which is a long time ago. I mean, we're talking about the Eisenhower administration. So it is extremely low. If we had just kept pace with the high watermark for the minimum wage, right now it would be just shy of $14 an hour. So not everyone makes even that much. So tipped workers earn $2.13 an hour, which was a rate that was set back in the early 90s. And there are some folks who are disabled who get hired through special programs that are approved by the U.S. Department of Labor, who can make as little as $3.50 on average. And that's to say nothing for folks who are incarcerated, who often make anywhere between 15 and 25 cents an hour. So we need to improve on this. I think raising the minimum wage by itself would improve the livelihood of around 300,000 Kentuckians if we were to say raise it to around $15 an hour. And that would eliminate the need for a lot of the supports that we're going to talk about today. Not all of them, but many of them. So let's move on to the next slide. Speaking of which, we pay for many of the things we're going to talk about today, but about a third of our Medicaid budget, a good chunk of some of the new housing supports that we've created, improvements in several of these programs through our state income tax, as well as other forms of taxes. So people may have seen in the news recently, there's been an attempt to reduce our income tax. People may have heard the phrase, the march towards zero. That's an effort to take our income tax from where it was at 6% at the highest bracket back in 2018, all the way down to 0%. Just as a starting point, it's important to remember that the income tax brought in about $5.8 billion out of the $15 billion that we bring in as a state every year in revenue. It's our single largest source of revenue. It represents about 39% of the general fund. And it's also a revenue source that's better at sort of keeping up with the economy, because while sales taxes kind of go up and down, income taxes tend to keep rising, primarily because incomes at the top keep rising. Most of where our economy is growing is income for top earners. And we'll sort of show what that means for cutting the income tax here in a minute. But for now, let's move on to the next slide. So in 2022, the General Assembly passed a bill setting up the first 0.5 percentage point cut in the income tax, going from 5% to 4.5%, and setting up the conditions that have to be met in order to keep doing that. So the two conditions that have to be met are essentially that there has to be so much money in our state's rainy day funds. It's called the Budget Reserve Trust Fund. And we have to bring in slightly more in our general fund through our revenue than what we're spending. So we met that again this past year in 2023. So we reduced the income tax by another 0.5 percentage point starting next year. What that means is that we've essentially cut actually a little over $1 billion out of our general fund by these two cuts alone. It also means it sets up a double disincentive, if you will, for future spending. So one, it gives us less money to spend to begin with by reducing the income tax, but it encourages the General Assembly to put more into our savings account where it just sits there. Right now we have about $3.7 billion sitting in our Budget Reserve Trust Fund doing nothing. It also encourages the General Assembly to keep spending low so that they hit that target. So put more money on a shelf and spend less on the programs that need it. That's kind of what we've set up with this twofold condition that has to be met in order to continue cutting. So let's move on to the next slide. And just to put in perspective how much we've already cut, it's like I said, a little over $1 billion, $1.2 billion. That's around half of all the money we spend as a state on Medicaid. That's certainly a large chunk of what we spend on K through 12 education. And it's more than we spend on all of our post-secondary education institutions combined. So think UK, U of L, KCTCS, all of those. If you put them all together, that 1 percentage point reduction in the income tax is more than we spend on that. So it's an extremely expensive cut, and it really puts a strain on our ability to make investments in the things that matter for our citizenry. So let's move on to the next slide. And while it does hurt programs that primarily benefit middle and low income folks, the income tax cut actually helps higher income folks. And this is kind of what I was talking about earlier. So if you look at people who earn more than, or households that earn more than $100,000 a year, and just to put that in perspective, the median household only has about $60,000 in income each year. So we're talking about the top 20% of households. They get 65% of the value of cutting the income tax. If you just look at the top 1% of earners, so we're talking about people who bring home over $500,000 a year. On average, they make about $1.4 million a year. They get about 20% of the benefit from this cut. So that is a huge, huge benefit to high income earners. And it doesn't really impact very, very low income earners, because if you're below the poverty line in Kentucky, you don't pay an income tax. We have a certain deduction essentially for low income households. And so they're not even seeing any of the benefit from this type of cut. So let's move on to the next slide. So remember again, we have two conditions after that. We have to have a certain amount in our budget reserve trust fund, and we have to bring in a certain amount in general fund revenue. Those two conditions were not met. The first was, so we have, again, around $3.7 billion sitting in our budget reserve trust fund. Remember that that's a huge percent of our total budget. It's about a quarter of it. We've never had 5% in our budget reserve trust fund until the pandemic hit, and there was a huge influx in federal funds that we taxed out of the economy and also went directly into our budget. So that made a huge difference, and now we're sitting on an enormous amount of money. But we didn't bring in enough in our general fund, in our typical taxation system, to be able to meet that second trigger. So what we're hearing now is are quotes from folks like the Appropriations and Revenue Chair in the Senate, Chris McDaniel, who's saying, because their effort is to reduce the income tax to zero, they need to exhibit spending restraint. And he said things like, we don't need to spend every dollar that rolls into Frankfurt, that many of our funding levels are going to be frozen moving forward. Just a reminder, when you freeze spending levels at the state government level, that doesn't do anything for inflation. It doesn't reduce inflation. It means ultimately that it's a cut to those agencies and services and programs that we care about. So I think it's really important that as we talk to our legislators, we talk to them about the need to invest in things that we really care about, and a huge need that is coming up very soon and really has existed for a long time is childcare. So with that, I'm going to hand it over to Kara, who's going to talk to us about what's going on there.
Well, what's going on there, we go to the next slide, is not going to be a surprise to most people. Childcare is still unavailable. Childcare, we still are sitting in a situation where 60% of Kentucky kids live in a childcare desert, which means that 3 or more children need every spot that's available in a census tract. And what's going on is that you can go on to the next slide. We have fewer childcare providers now than a decade ago. We have had this slide, and see that like flat line there at the end. You see how I'm pointing at that, like that in any way helps anybody be able to see where I'm going to. Thanks, Alex, for being my finger there. That is our ARPA injection, because we would have had basically no childcare centers basically because of COVID, because when all of the kids were staying at home, there would have been no way for childcare centers to stay open. So we injected federal money to keep childcare centers open. So we do have had that, but we still are on this sort of downward trajectory, and we still don't have near enough. So even with that trajectory, we're still in this 60% childcare desert. But that money, go to the next slide. That money is not enough, and it's about to run out. And then, of course, childcare, even where it does exist, is unaffordable no matter where you live. It costs a lot, and it should cost a lot. Childcare should be expensive. I don't want anybody to get the idea that there is some way, some mysterious, magical way to make childcare be cheap. There isn't. Childcare is and must be expensive because children require a lot of adults and required skilled adults to take care of them. And so that's just the way that's got to be. We can go to the next slide. We do have childcare assistance. The childcare assistance program is actually the most generous that it's ever been. It goes up to 85% of SMI, the state median income. That's the highest that it's ever been, which is really good news. So spread the word about that childcare assistance is at the highest level that it has ever been at. And we have some of our highest participation in our public preschool partnerships. So our public school systems that are adding on to preschool partnerships, we've got more slots available in more places. So there's a lot of good news in that space, but we still don't have enough slots for enough kids. We've got to come up with more qualified places for children to be. Go to the next slide. And then here is the scary spot. The federal ARPA money it ended September 30th, but the state has figured out a way to keep that money going through the end of this year. And the public preschool partnership money in that CCDBG ends in next year, September 24. We have to have state investment in childcare. So for this budget that starts in January, when the legislature comes in, we have to have public investment in childcare, or we will lose workers. Yeah, there's great coverage in the Courier Journal about the childcare cliff. Thank you, Adrian, for putting that link in the chat. So we have to talk to Chris McDaniel, the chair in the Senate, Amanda Mays Bledsoe, the vice chair in the Senate, Jason Petrie, the chair in the House, and Brandon Reed. And it does feature Dustin. Thank you, Dustin, for good quotes. Brandon Reed, the vice chair in the House, and of course, your individual members. We have to reach out to them and tell them that we must have investment. Public state dollars have to be put in. And then next slide, please. This is that image. If you'll see, there is nothing underneath that monster truck. That is what is currently going to be supporting after January, our childcare in Kentucky. And what happens whenever you don't have childcare? You don't have people in the workplace, and disproportionately, you don't have mothers and women in the workplace. And then our entire economy collapses whenever you don't have women in the workplace. So it's more than just our children, even though I hope we all do care about our children. It goes far beyond that very quickly. And of course, whenever you don't have children being cared for, then those children are neglected and or abused because they're in unsafe places. But then, of course, you don't have people going to work, or you have children showing up in workplaces that aren't safe for them. Did you all see that number there? Oh, terrifying. Oh, sorry, Alex. No, it was terrifying numbers to look at. And then here, this kind of like spells it out pretty clearly. First off, straight up, we do not spend enough on any of our children. Okay, so in our SEEK per pupil, that is what we spend on our school-age children, that 2,632, that needs to be a lot higher. But for our birth to 5, it is 128. That is a joke. So we need to, for 90% of brain development, birth to 5 needs to be at least as much as we are sending on our SEEK formula. So I'm asking that at least be $2,000 for that birth to 5 as a formula to use for childcare, to make it sort of a plausible formula to keep it moving with however many children we have that need childcare. Because currently we do not spend enough of our public dollars investing in childcare, which is a part of our overall economic formula, which is how we are able to have our adults in the workplace, which is how we're able to keep especially women in the workplace. So I hope that this is a pretty clear. Dustin made this chart. I think it basically explains the whole situation here. Says quite a bit about what's going on. And again, I hope it's very clear that we need good qualified adults providing appropriate development and care for our children all the way through all of their stages of life. And also they need to be fed. So let's see, I think Cassidy will talk to us about how we are going to feed children and adults of all ages.
Thanks, Kara. Hey, y'all. So I'm Cassidy Wheeler. I'm the advocacy coordinator with Feeding Kentucky, and I'm here to talk to y'all about food access and food assistance. So you can see this also scary numbers, like Kara said. So in Kentucky, 1 in 8 adults are hungry and 1 in 6 children are hungry. We do have 7 food banks that help us meet this need, in addition to all of the social safety net programs that we'll talk about. But all of that adds up to over 500,000 Kentuckians who don't know where they're getting their next meal. So here are some of the feeding programs that we have to meet the needs of hungry Kentuckians. So some of the SNAP, this is the largest feeding program in the country. This is a feeding program that is not demographic specific, so it's not specifically for kids or seniors or anything like that. And then these other programs we have are specifically for children, mothers, etc. An interesting thing that is important for y'all to know is that SNAP is the only program that undocumented folks aren't eligible for. These other programs beneath them, they are. And the citizen children of undocumented adults are eligible for SNAP. So if you have undocumented clients, that's really important information to know. And I think that that is also in the handout that will be going out to you all. So here we have an awesome graph on SNAP participation in Kentucky. So similar to Kara, I'm going to direct Alex to maybe use her cursor to gesture. So if you see that dip in 2016, yep, there we go. So that is the result of some decisions made by elected officials. And you can see that there's a significant drop in people who are participating in SNAP, people who lost their benefits because of significant barriers to receiving SNAP benefits. And then you can see pretty quickly after that, yes, thank you, Dustin, policy choices. This is a good visual representation of how policy impacts these programs. So you can see there's a huge drop there in 2016. And then you can see pretty quickly after that it goes right back up to the same number as before. If you go like a little bit further right. Yep, right there we go. So right over there, you can see that those numbers went right back to how they were before. So this just demonstrates that these policy changes didn't actually help people, get off benefits and become, less hungry and more, have more access to food. The same amount of people were eligible for SNAP benefits as they were before. They just weren't receiving them because of specific barriers. And then same thing you can see, in 2020, as we see SNAP benefits are kind of gradually going down until 2020. And then in 2020, the pandemic hit and those numbers jumped up really high, right? Understandably so. And then we had some COVID relief programs going on to kind of fund food security. And we had SNAP emergency allotments in place until that next big drop. So this was another policy change instituted by the state legislature in Kentucky. We chose to end the state of emergency and stop using SNAP emergency allotments. So there was a big drop in SNAP participation in Kentucky. So unfortunately, we still have lots of hungry Kentuckians and we have fewer people who are able to access SNAP benefits. So here's a kind of different version of the SNAP participation graph. So you can see how it breaks down county by county. And you can see that, in southeastern Kentucky, that's kind of the hungriest part of the state. Obviously, it aligns with a lot of what we see with poverty rates and lack of infrastructure and lack of employment. And then there's some interesting numbers here on the left side of the screen. So you can see that in 2022, $1.2 billion were brought in for SNAP, for income from SNAP, right? So all SNAP monies that are spent in Kentucky, that generates economic activity. It pays our local grocers, it pays our local farmers. And then we can see that benefits have dropped down in January 2023 to $91.8 million. So significant drop in the amount of money invested in our local economy from SNAP. So not only are hungry Kentuckians not receiving as much SNAP benefits in order to purchase food, but also our local economies, our local farmers are also suffering. So some good news, we do have a cost of living adjustment that has just gone into effect. So you can see that SNAP benefits are going up a little bit. It looks like they will increase somewhere between 3.5 to 3.7%, which is a decent amount. The minimum amount of SNAP benefits per month will still remain $23 though. So you should, if you have clients who are receiving SNAP benefits, they should be seeing a slight increase. And then there will also be some changes in deductions. So if you have clients who are receiving SNAP benefits, make sure that you're speaking with them about that, because, the more deductions they have, the more SNAP benefits they could be eligible for. So you can see that there are several different kind of categories here. All of this will be included in your handout, so you can kind of go through it at your leisure, and then also, keep it and use it when you're speaking with your clients. So some bad news, good news about the cost of living adjustments, but the bad news is that SNAP time limits are back. So you may hear them referred to as work requirements or work reporting requirements. So essentially these are requirements that SNAP recipients have to prove that they are working in a set amount of time. And if they don't submit that paperwork correctly, then they lose their SNAP benefits. So we know that the majority of SNAP recipients who are able to work are working, and SNAP time limits really don't help that. They just kind of create these cumbersome burdens and barriers, so that it makes, folks who are eligible for SNAP, who are working if they're able to lose their benefits and go hungry. So these came back, these came back July 1st, and this month is going to be the first month that people are losing their benefits, because it is a 3-month window. So within 3 years, you have 3 months to report work reporting requirements. So yeah, like I said, this month will be the month that we see folks losing their benefits. Here we do have county exemptions for time limits / work reporting requirements. So certain counties that are considered economically distressed, which is very largely tied to high unemployment rates, are exempt. So these gray counties, anyone living in these gray counties does not have to report their work hours. So that is good news that, these folks that live in these kinds of high unemployment areas are not at risk of losing food assistance. The unfortunate thing is that the folks living in these red counties, up to 33,000 people are at risk of losing their benefits. So that is a huge number. So here are some of the new exemptions for work reporting requirements. So these are brand new that came out in the summer, I think, late spring, early summer. So the 3 categories are people experiencing homelessness, people aging out of the foster care system up to age 24, and veterans. It is a there are self-reporting exemptions. So people, again, just self-report if they are part of these categories. And then you can see, so like I said, these are new exemptions. They've started in September. It's been a good, smooth rollout so far. And then there are these other exemptions. So anyone under 18 or over 54, folks who are disabled, pregnant folks, et cetera, you can kind of go through these at your leisure again. This will be included in your handout. So some updates on P-EBT and summer EBT. So y'all might know these are programs for school-aged kids who have missed school because of the pandemic. P-EBT was the program that began during the pandemic, and it's in its final phases and is transitioning into summer EBT. So for school-aged kids, that application has closed, and then the final funds are going to be distributed, I think, this month. And then summer EBT will also be going out in October, and it's $120 a child. And then EBT skimming. So y'all may have heard about this. Folks who are receiving SNAP benefits, they have what's called an EBT card, and some people were getting their benefits stolen off of their EBT card. So this was a problem I was hearing a lot about, at least last fall. And then in the end of year omnibus bill, Congress created a temporary fix for it where folks could get their benefits reimbursed. So that is only in effect until September of next year, with the idea that the Farm Bill, which is this kind of big piece of federal legislation that's passed every 5 years, will include a permanent fix for it. So if your clients have mentioned to you that they have experienced EBT skimming, they can get those replacements reimbursed, and they will just have to speak to DCBS about it. And then advocacy opportunities. So I know Kelly talked about this a lot at the beginning, but we do have many different opportunities for advocacy, especially on the federal level. So I just mentioned that we're looking for a permanent fix for EBT skimming in the Farm Bill. So the Farm Bill is a big piece of legislation that is up right now, and that is where SNAP lives. That is where a lot of the food bank funding lives. And it's really important that we pass a strong farm bill to support hungry folks across this country, especially as it relates to SNAP. So it's important that you contact your members of Congress and let them know that you support SNAP and you support hunger relief programs, and you hope that they will pass a farm bill that includes those, especially Senator McConnell. He sits on the Ag Committee, so he has the most say in the farm bill. And then, of course, as Kelly said, we are coming up on a state session. There's likely to be a lot of legislation up that will impact feeding and hunger. So important to keep up with that and to contact your state legislators and let them know that you support feeding programs. With that, I'll hand it over to Marcy.
So lots of things going on in food, of course, and we welcome you to behavioral health. And we're talking about 1915Cs and SMIs today. Go ahead and click. Thank you. So I wanted to start out with the 1915I SPA, which we were calling a waiver for serious mental illness. You all probably have seen Sheila's slide from before. I broke it down and made it a little bit easier to digest all the history here. So in 2021, there was a task force for severe mental illness, and that is a typo, should be a task force on severe mental illness at the KYGA, so at the legislature. That led to the passage of SJR 72, which is a law in 2022 that mandated many of the recommendations, including that this thing exists. So they started out earlier in 2023 with an 1115 Medicaid waiver that's a little different. And we said, wait, we need 24-hour respite housing. We need supportive housing. We need supportive employment. So they came back to us with a 1915I state plan amendment. We were calling that a 1915I waiver because we tend to use that language inappropriately. So just so everyone knows, this is the same thing we've been talking about for a long time, but it is confusing. There is a state recording of what they have offered. You can click there in the slides later. And the slides from that are there as well under the Here button. So if you want to know more and get into the weeds, feel free to do so. Definitely check them out if you can, and provide some public comment to Medicaid via the email, that Medicaid public comment at kyng.gov. Some of the concerns that we have right away were housing criteria don't seem very well defined. Housing employment needs for serious mental illness and substance use disorder differ. They added the substance use disorder that's not part of SJR 72. It's not that we're against that. There's just different needs in the different population. Also, they're saying right away that they're going to limit it to 100 slots at first. That's not enough to serve the need, of course. So please plan to attend an in-person town hall. I was hoping to have dates, times, and locations, but those are not ready yet. So stay tuned to KVH's newsletter and other places for that information. Next slide, please. It is Mental Illness Awareness Week and World Mental Health Day. So hoping everyone can check this out. Some things happening today in Lexington. The Candlelight Vigil is at 6:30 p.m. at Participation Station. That's on the corner of Red Mile and Versailles Road, basically. NAMI Walk Lexington is Saturday the 7th at BCTC Newtown Pike. The Out of the Darkness Walk for Suicide Prevention is at Moondance Amphitheater at 10 a.m. on the same day. NAMI Louisville just had their Step Forward for Mental Health Walk on Saturday. We heard things went really well. And at MHA Kentucky, we're emphasizing our free screenings on Depression Screening Day, which is Thursday. If you have a way of sharing that information from our social media and other places, we would love for you to do that day. Depression Screening Day is Thursday. Mental health first aid is having a 10 ways to take action before World Mental Health Day, which is October 10th. You can hit that hyperlink as well when you get the slides and take it and do that as well. There's some really cool things to do. It's very easy, simple. Go ahead, you're fine. Changing the slide is great. 988, just a real update. We want to keep running 988 in front of folks, right? We want to make sure that you know it's the suicide and crisis lifeline. No penalty if you're not in crisis, and you can call it if you are the person that is with someone else. You don't have to be the one in crisis. They continue to have an incredible increase in calls. There has been an increase in the first responder workforce to help answer those calls here in Kentucky. Calls will be answered. Over 80% of them are answered by Kentuckians. So we're thinking that's a really good number. Less than 2% of calls in Kentucky were referred to any law enforcement or ambulances. We continue to shrink that number. I'm really excited about that. That means that folks are getting the help they need over the phone and don't need an in-person situation. So that's really cool. No lights and sirens, as they say. Option 1 for veterans. Option 2 is Spanish language. Option 3 is LGBTQ. It previously went to Trevor Project. It is now to a specific project of LGBTQ answerers who have agreed to answer for all ages. Trevor Project tends to focus on youth under age 25. That doesn't mean they're going to turn you away. But option 3 just makes sure that 988 gets everyone answered. So that is a slight change we wanted to bring attention to. There was additional funding awarded this month. So there's going to be some really cool increases in, answer rates are going to get better, increasing workforce, and some mobile crisis and other response stuff is going to grow. Next slide, please. How do you know if help is needed? When do you know if you need to call 988? Keep an eye on yourself or a loved one. Take notes of changes that affect everyday life. Are they eating or sleeping too much or too little? Are they irritable? Are they easily crying or feeling sad? Have they increased their use of alcohol or other drugs? That's usually a big sign in adults. The lack of concentration, forgetting important dates, things to do. Not having energy or desire to keep up with exercise or other routines. Isolating from other people, not engaging with school or work. Those are all pretty decent signs that it's time to call 988 and check on something, or at least have a conversation with someone. If those changes are for 2 months or more, it's definitely time to check with primary care about your symptoms, concerns, talk with a trusted friend or a colleague. Screening is another good way to do that as well. Kind of check your symptoms, see how you're doing, see if that's something that we think you're seeing a little elevated compared to normal, right? But when in doubt, it's always okay to reach for help, however you reach for help. It doesn't have to be 988, but however you do so. Go ahead and change the slide for me. Sorry for reading the slide, folks. And in case you didn't know where to call, your community mental health centers are your mental health safety net. They have to take everyone. They do take insurance, and they have offices in every county, just about or really close to. And these are their phone numbers. They're always with you in this deck. I wanted to make sure those are there. Go ahead, next slide, please. And now it's time for Adrienne Bush to talk about some housing.
Thanks, Marcy. All right. So I'm with the Homeless and Housing Coalition of Kentucky, and it's good to be with you all. Next slide. All right. So the housing update today, we're going to talk first about federal and state disaster housing. And that is, as you may remember from last month, the Community Development Block Grant, Disaster Recovery Grant. It is still under development. This is the $298 million that is designated for Eastern Kentucky flood relief. A portion of that will go to housing recovery. It's still under development at the Department for Local Government. One reason I was particularly worried about the shutdown and remain concerned about it with a 45-day reprieve is that this plan has to be submitted to the U.S. Department of Housing and Urban Development for approval before it's deployed. So they still have their survey open if you are in the region and want to take it. And then the other piece of disaster recovery that kind of came into play in the talk around the shutdown was the FEMA, the Federal Emergency Management Agency, was running out of funds to actually respond to both current disasters that are happening, recent ones like hurricanes and wildfires. And that actually impacted our folks in Eastern Kentucky because of the FEMA buyout program. And right now the counties are fronting those costs and expecting to be reimbursed from FEMA, but with the looming shutdown, FEMA had paused payments and reimbursements to our county governments, which is not great. It is my understanding that with the agreement in place that the disaster fund has been replenished, but again, it's really hard to respond to disasters when the overarching government is going in and out of business. So, all right. And then with the Rural Housing Trust Fund that was appropriated by the General Assembly in the 23 session, we anticipate, since that application window has closed for housing developers in Eastern Western Kentucky, hopefully awards will be made in October. And then once those funds are available to the developers, then households will be able to apply for assistance. So we'll keep you posted on that. Next slide. Okay. So last month we talked about the Housing Not Handcuffs campaign, which is kind of a national group of advocates, and that was developed as a response to anti-homeless criminalization, anti-housing first trends across the country. They're just kind of popping up, right? And we are not immune to that in Kentucky. And so there is cut and paste legislation that has been considered and even passed in other states like Missouri, Texas, and Tennessee, with a bunch of elements, including statewide camping ban, diversion of federal funding for homeless services from evidence-based housing and services, lowering of due process protections to involuntarily commit people experiencing homelessness, threats of jail, fines for non-compliance, and potentially creation of homeless outreach teams. Okay, so next slide. All right, so last week, members of the Republican caucus representing Jefferson County, about 7 of them, held a press conference to present an omnibus bill that has 18 parts. So as housing advocates, these are the parts that we are concerned about. And this is what we know from what the media has reported. We don't at this point have a bill draft with specific language. So we're going on what we know. And there are specific pieces that, quote, target homeless populations, that would ban street camping in public places, and violations of these provisions may be charged as criminal misdemeanors. Police would be allowed to physically relocate people who are camping in public places. Property owners would not be held criminally liable for defending themselves against, quote, aggressive action, which was not defined during the press conference. Mentally ill individuals could be involuntarily confined. It would allow those with eligible mental illness to be remanded to a sheriff or a peace officer's custody when discharged. And it would enable local governments to create designated camping areas, but allocates no real funding to do so. So some of these elements from the previous slide are now on this slide. Next slide. All right, so one of the bill's proponents, Representative Hodgson, said in WFPL that the bill does not provide any resources or guidance on where homeless people should relocate to, because public property is pretty broad definition, or provide assistance for cities hoping to provide alternate housing. So again, this is just part of a cut and paste bill that requires states to move people without any real plan, any offer of shelter or housing or anything like that. The timeline is that it's expected to be presented at the Interim Joint Committee on Judiciary in December, the last meeting of the year, and that it would be officially filed. We're anticipating the first week of the legislative session in January. To hold a press conference indicates it's pretty high priority. And I just want to point out, in Louisville alone, we have 1,600 people who are homeless and only 750 shelter beds. I'm not talking about housing. I'm literally just talking about the intermediate solution of shelter. The bill as presented does nothing to change that. And so one of the things that we are trying to communicate with our representatives and senators is, first of all, we know housing is what solves homelessness. That takes time. We are at a severe deficit of 89,000 rental homes across the state for extremely low-income Kentuckians. In the meantime, if we want to actually address unsheltered homelessness, because I think we all want to address unsheltered homelessness, most of all the people experiencing it, here's both fundamental solutions with permanent housing and some intermediate ones with shelter, trauma-informed services, not remanding people into custody and charging them with fines for existing. So as this develops, I encourage you to stay tuned to calls for actions by following us on social media. And there is our handle at HHCKY. And with that, I will turn it over to Miranda to talk about healthcare options for the uninsured.
Hello, everyone. I'm Miranda Brown with Kentucky Equal Justice Center, and I want to talk about healthcare options for people who may not have ever had health insurance or who may have lost it recently due to the public health emergency unwinding. And so these will be options for folks in that boat. I'm going to talk about three primary programs. So go ahead and go to the next slide, please. So the first one is emergency time limited Medicaid. This only helps with emergencies, and it is for people who are uninsured but low income enough that they would qualify for Medicaid, but for some reason don't. And generally that's going to be because they would qualify for Medicaid except for their immigration status. Other folks could get emergency time limited Medicaid, but they could also get regular Medicaid. So immigrants are the main folks who fall in this boat. And this type of Medicaid is limited to emergencies. It covers doctor's bills, hospital bills, and more, but only to care for an emergency and only for 2 months at a time. So childbirth is an example of something that it would cover. And for extended care related to an emergency, people can request an extension of their emergency time limited Medicaid beyond 2 months. However, it will not cover organ transplants or nursing home care. Do you have to have low income? Yes, just like with Medicaid. How low depends on whether you are a child, pregnant person, adult, elderly person, or a person with disabilities. How do you apply? You can apply in person at a Medicaid or food stamps office or DCBS office, or call DCBS at the number listed here and tell them it's important to mention emergency time limited Medicaid by the full name so that it doesn't get confused with other programs that have similar names. You could also potentially apply at the hospital when you have an emergency. You can also apply on Connect, connect.ky.gov, or with the help of a connector. The important thing here is to answer all of the questions accurately in the application on Connect. And if you potentially qualify for emergency time limited Medicaid, it will generate a question as to, do you have an emergency medical condition, or does someone in your household? And so then if you answer yes to that question, it's effectively screening you for emergency time limited Medicaid. And once you submit the application through one of these ways, you have 30 days to submit a signed statement from a medical provider explaining your emergency, and that the absence of immediate medical treatment could result in placing your health in serious jeopardy or serious impairment to bodily functions or serious dysfunction of a bodily organ. So when should a person apply for this? To make sure that bills are covered, you must apply within 3 months of your emergency care. And is your information safe? Yes, DCBS only uses information to determine your eligibility for the program. They would not share your information for other purposes, and federal law protects your Medicaid application information. So next slide, please. The second program that I want to talk about is help with hospital bills. So these programs have different names: charity care or financial assistance. Essentially, most hospitals are nonprofits in Kentucky, and the Affordable Care Act says that they should make plans to serve their communities. Many hospitals reduce or pay for bills through a financial aid or charity care program as part of their plan. Hospitals also get money to care for people who cannot afford to pay. One way they get money is the Disproportionate Share Hospital, or DSH program. DSH helps Kentucky hospitals that care for many low-income people. It is a pool of money to help cover the hospital's costs. To get the money, hospitals must show that they're caring for people who don't have insurance. So who can this help? DSH charity care and financial assistance at hospitals help people who have low income, who cannot afford to pay for their care. And the hospital, however, may require that someone apply for Medicaid or K-CHIP first in order to show that they don't qualify, so that they then need to resort to one of these programs at the hospital. And then again, is your information safe? Yes, federal law protects the privacy of healthcare patient information. And how do you apply? Many hospitals will check at the time of care to see if you need help for pay. If your hospital doesn't check, you can ask for help applying for charity care or financial assistance afterwards. So you can ask during your visit or later. What if the hospital doesn't screen you for DSH or charity care or financial assistance, or you're having trouble getting assistance with that when you ask? We would really love to hear about that at Kentucky Equal Justice Center, so I've included our phone number there. And then, do you have to have low income? Yes. Excuse me. The hospital's forms will ask for income information. Many hospitals will require you to show that you have low income. They may also ask for proof of your expenses or your resources, such as money you have in the bank, but the requirements may be different for different hospitals. So next slide. The third program I want to talk about is just general routine medical care for people without health insurance. So it's great that we can get this at places called community health centers, or CHCs. You may hear them called federally qualified health centers or rural health centers. And these kind of community health centers may get federal funding to provide healthcare to people regardless of immigration status or ability to pay or insurance status. So do you have to be uninsured or low income to go to these community health centers? Not necessarily. You can get care from a FQHC with or without health insurance, but if you are uninsured, you can get healthcare and prescription medicines on a sliding fee scale based on your income. And is your information safe? Yes, federal law, again, protects the privacy of patient information. So what services are available? At FQHCs, they often offer primary care, pediatrics, OBGYN, dental, behavioral health, pharmacy. Some clinics may even provide vision care or other specialties. So where can you find an FQHC? You can find a health center by searching with your zip code on the map, available at findahealthcenter.hrsa.gov, or you can call the Kentucky Primary Care Association at the number listed here. So those are the three programs, and I have one more slide just to talk about some, go ahead, thank you. Just to talk about some general information about when you're accessing these types of programs. For each of the three programs that I just ran through, you do not have to have immigration papers or a social security number to get help from these programs. Using these programs does not affect future immigration applications for an individual. The only programs that do affect future immigration applications are cash assistance like KTAP or Social Security or Supplemental Security Income, SSI, or long-term care institutionalization at government expense. And then what if you or the person you're trying to help does not speak English? Federal law says all programs with federal funding must serve people who speak other languages. So that includes DCBS, the Department for Community-Based Services, many hospitals, and federally qualified health centers. You have a right to an interpreter, so ask for one. Under Title VI of the Civil Rights Act, federally assisted programs cannot discriminate on the basis of national origin. And that means that they must provide assistance in the client or the patient's preferred language. So this applies to DCBS, which processes applications for Medicaid, SNAP, KTAP, CCAP for childcare. It also applies to medical providers that accept Medicaid or other federal funding sources. And I want to add here that persons with disabilities who require alternative means of communication and individuals who are deaf or hard of hearing or have speech disabilities also have the right to interpretation and interpretive materials. In either case, well, for anyone, when it comes to applying for these programs for Medicaid or other programs through DCBS, you also have the right to appoint an authorized representative who could speak on your behalf if that's easier. So that is all of my slides, and I will pass it over to Priscilla to talk about Medicaid renewals.
Thanks, Miranda. Okay, so today we're going to do a quick rundown of Medicaid renewals. Let's go ahead and hop in. Next slide, please. So as we've talked about over the last, oh my gosh, so far this entire year, Medicaid renewals have restarted in Kentucky. They restarted April 1st, and so we are officially 6 months later, and things are happening. We'll get a little bit more into that, but they do run through April 2024. It's so important to make sure that contact information is updated and connect. If you need any help knowing how to do that, reach out to a connector. NCOs are also doing outreach to folks, and members should receive notification of their renewal the month before the renewal is due. So for folks who are due at the end of October, they should have received a notice back in September. If you don't, definitely reach out to a connector and get some help making sure that you turn in your documents and know what you need to do to keep your Medicaid. There are also unwinding resources available on the state's unwinding page, Medicaid Unwinding at MedicaidUnwinding.ky.gov. And then we have our handy dandy explainer that's also available in English and Spanish. You can always check your Medicaid renewal date in the system. You can do that by logging into Connect and check the self-service portal. You can call the Connect hotline. You can meet with a connector who can look it up for you, or you can always ask your provider at the doctor's office to check KY HealthNet. But make sure you know when that's going on, and you don't want to miss out on making sure you keep your Medicaid. So next slide, please. So here are an example of all of the notices that everyone has been receiving so far since renewal restarted and will continue to receive moving forward. The three notices, there's the notice of eligibility. Very quickly, that's just it's telling you that they have reviewed your application, they think you're still eligible, and they will likely extend it for another 12 months of coverage. The RFI, for both the RFI and the renewal packet, you have to act to keep your Medicaid. So with that notice of eligibility, you don't have to do anything, you're good. It's just letting you know that they've extended your coverage. But for the request for information in that renewal packet, you do actually have to keep action to keep your coverage. So for the RFI, they'll ask for usually verification of income, and you have to submit that documentation. For that renewal packet, it is a pre-populated packet with information that's on the case. You just have to walk through that notice and make sure that all of the information on there is correct. If it's not, make a note on it, just write on it, and then you do have to sign it and return it. So again, for both that notice of eligibility, you don't have to take action to keep your Medicaid, but for the RFI and the renewal packet, you do have to send something back to the state for them to determine your eligibility. So next slide. Okay, so The first thing to do when you get one of those notices, if you have received a notice notifying you that you've lost your coverage or you will lose your coverage, the very first thing you want to do is make sure you report a change in your in Connect. So again, you can reach out to a connector if you need help doing that. You can call the Connect helpline, the Connect call center. But the first thing that you want to do is to report a change on your application and just make sure that all of your information is up to date. Specifically focus on that income because it's important to know, a lot of folks have had income changes over the last 3 years, and depending on how old that information is, oh, sorry about that. It could still be within the time frame that they can use it to say whether or not you're eligible or not, but it may not still be up to date. So when you get that notice, you want to make sure to update it with your exact right now point in time. What is your income? What is your household situation? How many people are living with you? All of those things, you want to make sure that those are updated right now for where you are when you get this notice. If you do lose your coverage, if they say, hey, we don't think you're eligible, you can always ask for a reconsideration, and you don't have to formally request a reconsideration. You just have to submit those updated documents. So for folks who received a termination because they did not respond to a notice, it's a very simple process to receive to request a reconsideration period. All you do is submit those documents that they requested. So if they ask for income verification, just submit those docs. If they've determined you ineligible, you can request a reconsideration, and they will review your case. And if you still think that you're not eligible, and if they still determine you not eligible, then you can always request an appeal. And you have 120 days to request a fair hearing. So definitely make sure to do that. If you have lost your coverage, if you've gotten a determination that doesn't make sense, if you are certain or you feel really confident that you're still eligible for Medicaid, please, please, please reach out to a connector to get help to make sure that everything is up to date and you can just have a little help walking through that process. Next slide, please. Okay, so every month there are monthly stakeholder meetings that the state is hosting. So DMS hosts an ongoing stakeholder engagement meeting for everyone throughout the state. It's every third Thursday of the month at 11 a.m. It is linked here. You can ask questions when you register. You can submit questions ahead of time. So if you want to know more about data, if you want to know more about the process, you want to just have any questions that come up about the unwinding or Medicaid renewals, sorry, they will use both terms. If you have any questions that you want to ask and you want to hear directly from the state, that's a really great opportunity to submit those questions. If you submit them ahead of time, they are very likely to answer them during the meeting, but if they don't, they will update it in the frequently asked documents. Frequently asked questions document that they keep posted on their page, but I've also linked here. So that's a great meeting, definitely worth going over, and they will often go over just updated monthly data, what does enrollment look like. So definitely a good opportunity to hear from the state about how things are going. Next slide, please. All right, so now we have heard a lot of different issues coming up with Medicaid renewals. Really specific, a couple of problems that we've heard are folks with HCBS and Michelle P waivers, losing their waivers, getting termination notices, folks with zero income receiving termination notices, folks with SSI receiving active renewal packets, they should be passively renewed. Folks who have received duplicate notices. So maybe you got a notice at the first of the month and you immediately submitted your documents, and then 2 weeks later, you're getting another request for information. And all of that makes it really confusing to know, do you need to submit that information again? Was what you sent in not sufficient? It makes the whole process a little bit more complicated. Folks who have submitted their documents and still received a termination notice. You'll see that a lot more if you've either done it online or in person. And if that, say your renewal is due September 30th and October 1st, you immediately got a notice that said you are terminated for failure to submit documents, or it's, a week later and you get a letter saying that you were terminated for failure to submit documents. If you know that you submitted those documents, if you uploaded them, if you went to the DCBS office, all of that is incorrect and should not be happening and needs to be escalated to the state. So we have put together a Medicaid issues collector, which is linked here. There's also a flyer there that you can print off and keep in your office and just share publicly. We want to hear more about what's going on. We need more case examples of what's happening. We are trying to track some of these issues for ourselves, but also by reporting these cases directly to the state, we're able to get them resolved pretty quickly so that we can make sure that folks keep their Medicaid coverage or get re-enrolled in Medicaid without a gap or a gap in coverage. So it's really important for us because we want to make sure that we're tracking issues and we know what's going on so that we can work with the state to hopefully identify a solution so that other people don't improperly or unnecessarily lose their coverage. So if you can share that flyer, that survey with folks, if you know anyone who's having any issues, please feel free to fill out that survey, share it publicly, consumers, sisters, everyone, it's open to them. And if you have any questions more specifically about issues you want to raise, or if you just want some more context about what's going on, please feel free to reach out to me directly, or you can post on our website, KY Loop, where we're also collecting some of these issues. So next slide, please. Okay, so Medicaid renewals, like I said, we are, they restarted 6 months ago. We're 5 months into actual cases being run and terminated. So this looks terrible, but enrollment fell for September. Since the first week of September, it fell by 66,300. That is a lot of people. And in the last week of September, 80,000 people were terminated. Now that number goes back and forth because there are still people who are applying throughout the year. Casework is still happening throughout the month and the year. And so some folks are, if their cases were pending, those determinations are being made throughout the month. And so they're being renewed into coverage and get put into that enrolled bucket, while other people are still going through that enrollment process and being terminated. So it's a little complicated, but the big number is 66,000 folks lost coverage in September. So it's a big drop. We're tracking that. I think we're tracking that. The next slide is about fee-for-service specifically, which is even the enrollment has fallen pretty steeply there too. So in the month of September, 7,300 folks on fee-for-service lost their coverage. To compare, that's total enrollment has fallen 10.4% for NCOs, that first chart, and 17.2% for fee-for-service. So it is falling almost twice the rate, which is pretty concerning. And there are now 187,556 fewer people on Medicaid than there were in the last week of April. So a lot of people have lost coverage over the summer. We know a lot of them, some of them are factually ineligible, but we also know that about 40% of folks have lost their coverage because they did not respond to a notice. An eligibility determination was never made. They did not lose their coverage because they were found to be factually ineligible. They lost their coverage because they did not respond to a notice, or they experienced problems trying to respond to a notice. So it's really important that we're making sure to get that message out there about Medicaid renewals, helping folks as much as we can to get the education out there, assisting them, connecting them to connectors and resources. And again, if you know of any people who are having problems or difficulties completing the enrollment process, please reach out. We are trying to track those cases and report them to the state so we can make sure that folks are not losing their coverage. Next slide, please. Okay, so this is the last month before open enrollment this year. Open enrollment starts November 1st. There are still plenty of opportunities for folks who are no longer eligible for Medicaid. If you're truly ineligible for Medicaid, you can still get other coverage through a qualified health plan on Connect. If you've lost your Medicaid, you're eligible for a special enrollment period, so you don't have to wait. You don't have to wait until open enrollment to enroll. You can apply right now and get coverage for next month. So that's important. And here are a bunch of other opportunities. If you do have any other life changes that are going on, any sort of loss in qualifying coverage, that's Medicaid or employer-sponsored coverage. If you move or change in your household, someone dies, experiencing any technical or system issues, that's also a special enrollment period. So if you know folks who have tried to enroll in a QHP, but they've run into some problem in Connect or some enrollment barrier, you can still get a special enrollment period. And that's where you want to make sure to reach out to a connector and they can help you get enrolled in a plan. All right, next slide, please. Okay, and with that, I'll turn it over to Emily. Thank you.
Thanks, Priscilla. I have to say, we don't usually get to the end of this slide deck with a few minutes to spare. So I feel like everybody was on point today. Just to share, oh, actually, we've got a slide on vaccines that Kelly may be able to cover better than me, but there is some really good news that we've got a new COVID booster and some RSV vaccines, and I'm going to let Kelly tell you more about it. We just want everyone to be spreading the word.
This is unplanned, so I'll just create a script for you, but it's respiratory season. It's the fall, and we know that as the sun visits us less, our immune systems get weaker, and it's time for an immune system update. Both flu and updated COVID shots are available. Maybe not as many vaccine providers as we have seen in the past few years, but they are out there. Myself, my husband, and our 2 little babies all went as a family and got ours last week. So I know that they're there. RSV vaccines are available for everyone age 60 years and older. You do not have to have an immunocompromising situation to get an RSV vaccine. Our babies 8 months and younger can get the monoclonal antibodies immunization. And if you have a situation where you're especially vulnerable for complications and severe infections from RSV up to 19 months old, you can get that monoclonal antibody shot for your baby or toddler. Keep on the lookout for maternal RSV shot updates. It has been approved. It is coming soon. And then we threw in pneumonia and DTaP and Tdap just because we are seeing a lot of instances with our whooping cough pertussis outbreak. Quite a few folks throughout the state are having severe issues from pneumonia. It's time. Just go get your updated shots. They are available, and it keeps us all healthy and safe. And then the next slide is about pharmacist reimbursement. So if you know any pharmacies that you work with personally, or just in the work you do and you want to pop into a Walgreens just to make sure, hey, are you offering vaccines to Medicaid users in Kentucky? Make sure they're aware of this reimbursement rate increase. If they are not offering vaccines to Kentucky's Medicaid population, there's maybe a little bit more of a financial incentive to do so. Their vaccine reimbursement for Medicaid members is increasing this month on October the 16th. And then I'll kick it back to Emily, and we got a minute still.
All right, why don't we go to the next slide? So our explainers, we've been working on doing, if we go back one, more and more explainers on some of these topics: Medicaid renewals, QHP, special enrollment periods, SNAP eligibility and reporting requirements, KTAP, cash benefit. So we will be sending out links to these explainers for you to use in the work that you do and share with clients and members of the community. We're making some updates to flyer or to the explainers as programs change, like SNAP reporting requirements. So watch for updated explainers too, to make sure you're handing out the most up-to-date information. And then the last slide that I want to share is just another reminder of our roadshow. So go to the next slide. And please join us if you haven't already at one of these events. We love seeing people in person and getting to learn a little bit more about what's going on in the community. And we will be sending out, like I've said a few times, materials, the slides, the recording from today, and an evaluation. We'd love your feedback so that we can continue to cover the topics that are helpful to you and make sure that we are using our time well. So thanks again, everybody, for joining us today. And we look forward to seeing some of you in Lexington later this month and others in our webinar in November. Have a good afternoon.